what are we going to have? We're going to have a lot of different people. So I'm not going to tell you. I want you to stay tuned and check out.
Because he doesn't know.
All right, guys. Welcome back to another episode of my brand new YouTube series called Own Your Shit. All right, so we're interviewing with health and wellness professionals that own their own businesses and just going through kind of the background, what brought them to where they are, why they do what they do, and just general information and education for you guys out there if you have any questions, all right? So today we have Naturopathic Doctor and Acupuncturist, Dr. Amanda Placeres, right?
Yes.
Okay, Dr. Amanda Placeres. So I've personally worked with her on numerous occasions. I love what she does. So Dr. Placeres, tell us a little bit about your background and what kind of brought you into the realm of holistic healthcare.
Well, that's not an easy question to answer. Growing up, I knew I wanted to be a doctor of some sort. I knew I wanted to help people, and I loved to explore kind of weird and funny things as a kid. I'd play doctor with my dolls and pretend to...
Totally normal, guys.
Not at all, but pretend to like operate or, you know, talk to them or take their temperature and do weird things like that. But as I got older, I realized that I actually really loved the sciences. Okay. And it, you know, in high school, I kind of knew that I wanted to go the pre-med route. And, you know, growing up, I wasn't very well versed in natural therapies. Didn't actually know about naturopathic medicine. Knew about acupuncture, but never had it myself. It was a mentor in college who actually exposed me to more of the natural therapies, and when I was exploring going to medical school, she had asked me to look into other fields, and I came across naturopathic medicine, and it was kind of like love at first sight, and okay. I just was hooked, and I said, yes, I have to give this a try. And then the acupuncture kind of just came later on through my schooling, as acupuncture actually became a way for me to help de-stress and work through, you know, being a 24/7 student. And it was one of the ways that I was able to help myself when I was having pain or on my road to having certain health issues. Acupuncture became a way for me to help those things really in the moment. And I knew at that instance, you know, seeing how much it helped me, I said, I have to offer my patients acupuncture as a tool alongside my natural therapies because it can be really great for my patients in the acute, in the moment.
Awesome. So tell us what kind of, I know you said you fell in love with it, but why more of this angle as compared to, you know, being a gymnast, you know, personal training or personal coaching for health and fitness as compared to the naturopathic acupuncture component?
I have no idea. I just...
Okay, honest answer.
I mean, I was a gymnast for many years, and I loved the aspect of the gym. I think, you know, part of why I stopped gymnastics was I injured my body. I didn't know at that time how to properly work out and do the things that could prevent me from having problems as I was older. And it was during my training as a gymnast that I basically had to stop. And so maybe I didn't pursue, you know, being an athletic trainer or personal trainer or even, you know, being a coach because I just, you know, I already had separated myself from that. But I do know that I love what I do now, which is really helping patients prevent having any chronic or long-term issues. And I use that experience as being an athlete and also, you know, not doing some of the best things for my body to help people who are active, who are fit, to do things the right way and prevent anything from coming out of that.
Right. So one of the things that I really love what you said is that you love what you do now, and your goal is to help your clients or patients, as a doctor, help your patients prevent.
Yeah. Right.
So you've seen me, guys, and you know I work closely with Dr. Placeres as well, and we kind of both work in the same realms of prevention and preventative care. For me, I was breaking down in professional wrestling. You were breaking down as a gymnast,
yeah.
And I started to steer into the physical component of prevention and working on muscle activation and stretch therapy and stuff like that. So your end is the deeper holistic approach and the energy lines and all of the blood flow and everything else that goes into acupuncture as well, which is awesome, which is why we work closely together. Guys, if you have questions, please, you can comment below. Amanda will be happy to get back to you. We're going to put all of our social media stuff up here as well. Offhand, do you know your LinkedIn?
Dr. Amanda Placeres.
LinkedIn?
Yes.
LinkedIn?
Yes.
Not IG?
Yes,
Okay.
Dr. Amanda Placeres.
Dr. Amanda Placeres.
I actually have a LinkedIn.
IG?
Placeres Naturopathic.
Okay. Twitter?
I don't have Twitter.
No Twitter. That's okay. I don't like Twitter that much either. I'm on it though. But all right, we're going to link this up there.
Wait, you didn't ask about Instagram.
Wait,
you did?
I did. IG, right?
Facebook.
You can throw IG
Did
again.
you already ask about Facebook?
No. Facebook?
Dr. Amanda Placeres.
Okay, Dr. Amanda. And that's a page, right? Not your personal account.
It's a page.
Okay, so that's a professional page. So we're going to link all this up here on the thing. So tell me a little bit about somebody that comes to you, they find you, now you take health insurance, you don't take health insurance, and what would your kind of first evaluation or consultation consist of?
So, question about insurance. I do currently take insurance. I take United Healthcare, Oxford, Connecticut, Cigna, and Anthem Blue Cross and Blue Shield.
Okay.
I do offer, if a patient wants to come see me and they're not sure if we're going to be a right fit together, or they want to know more about me and my background, I do offer complimentary 15-minute consults that can be either on the phone or we can do them in the office, where patients can sit down with me and ask me questions about my background, experiences that I've had treating patients with their conditions. And I can answer not patient-specific questions, but general overarching themes about how I might approach that condition to help patients understand better what it is I do. So I can help patients whether they've got something acute going on as well as chronic. An example, it can be a patient who might have a chronic disease, maybe autoimmune, and they've been on medications for years and they're just not finding relief, or the suggestion is to up the medication or start new medications, and they just have been down this path where there's just no progress and they feel like they're missing something in their life and in their health. And so what I tell a patient is, I want to know why you're having those symptoms you're having. Okay, so you're having those symptoms and your doctor is telling you to take a medication. Well, what is that medication doing? It's really just covering up that symptom, and in fact it might actually be leading to other symptoms happening. Right. The difference between what I do and maybe your conventional doctors is I look for the underlying reason, and I want to find out how we can help the body overcome that. Maybe it's correcting deficiencies. And once your body is stable enough to heal, if you give it what it needs, it will heal. Now, we don't cure everything, but we can definitely help our patients live better, improved lives. And when working with your medical doctor, I have, and we hopefully can, help you get off of certain medications when the time is necessary.
Awesome. Very detailed answer. A couple points I wanted to touch base on that you mentioned. So like she said, a lot of the times I'm not knocking on doctors by any means. They have a lot of education. And
I love to collaborate with medical doctors.
Right. So doctors, collaboration. I'm not above saying that none of us know everything, right? That's why there's so many different professionals. There's so many different avenues of healthcare. But, one of the biggest things that we agree on is the fact that we need more understanding of how to address the physical or emotional, mental problem, and not just covering the symptoms or trying to fix the symptoms, right? So one of the biggest things I say is pain is a symptom of a problem. So we don't want to correct the symptom. We want to fix the problem, which will then correct the symptom, and then everything else kind of falls into place.
Yes.
So, awesome answer. So that's an initial consultation, and that's what people are coming to and expecting. Now, you do extensive blood workups, right?
Yeah.
For deficiencies.
So I can tell you a little bit about more what I do when a patient comes in. So, as a naturopathic doctor licensed in the state of Connecticut, we are able to do full physical exams. We can run blood work. We cannot prescribe medications. That also means we cannot take patients off of medications, which is why I love working with medical doctors and collaborating to help patients feel better. But we can diagnose, and we can do talk therapy, and we can do nutritional counseling. We have extensive education in nutritional counseling to help our patients understand their bodies and how nutrients can help the physiology. We use a lot of natural therapies that are evidence-based, backed up by science, that can be effective to help certain conditions. That might be vitamins, micronutrients. That also might be, should I re-say that?
No, you're good.
Okay. Vitamins and micronutrients. We might use different herbs and various combinations of herbs with supplements, or combinations of herbs and vitamins that are going to be the most effective for patients. I want to point out that our training does allow us to understand how those things interact with medications. And when you come see a naturopath, your treatment is individualized per your body. We don't have these cookie cutter, okay, you come in with this condition, here's how I treat you. I want to look at what's happening deep down in your body, biochemically, what's happening on that physiological level, and also mental, emotional. I can just talk all day on this. So the beauty of our medicine is that we have a lot of different ways to help our patients, and there are so many safe, effective, and natural things that we can use to help our patients overcome their conditions. And the mental, emotional part of it is also really great. It can be addressed with naturopathic herbs, especially because they have qualities that can help affect the mind. And I think that's sometimes the part that's missing in conventional medicine, is understanding that mind-body connection. And it might mean, it might make the difference for a patient whether I'm going to choose an adaptogen like rhodiola versus an adaptogen like astragalus. So how is their body and their mind connected and going to affect their treatment outcome?
So clearly we can tell that Amanda is very passionate about what she does, because I don't even understand the 2 words she just said. So if you watching don't understand the 2 words she just said, shoot her a message, ask her to explain it, maybe stop in for a visit if you're in Fairfield County, because she's awesome at what she does. So we've got the consultation, we've got the things. I want to get a little bit about some of the better or more favorite, I guess, issues that you've come across that you enjoy working with, but I also want you to shout out real quick your thoughts on the importance of networking, but networking with other health and wellness professionals in terms of collaborations like we're doing right now. Has that been beneficial to you, networking with other health and wellness practitioners?
Yeah, so, as a student, before I graduated, I was already on the networking game. I guess I was really interested in learning how to connect with people, and connect with people who may not be in the same, sphere.
Mm-hmm.
So I learned to try different networking groups and just learn to give my elevator speech and talk to people about what it is I do. And I found that networking not only helped grow my business, but it helped grow me as a professional and learn how to, again, talk about what I do. And so, I really enjoy working with other healthcare professionals and learning about what they do. I find that it helps grow my business because, when one health professional realizes how you've helped them and you have all these benefits you can offer their clients or their patients, they're going to also want to refer. And I think the best type of referrals are the word of mouth referrals, when someone's experienced how you've helped them.
Right.
What else did you want to
So I agree with all of that. I was a very introverted professional, and I'm around people all day long. My philosophy, which has helped boost me into launching a YouTube channel, right, with the video series called Own Your Shit, right, basically, has kind of pushed me into extrovert for networking, and really became good at what I did in terms of being able to connect the right people to the right people. So this channel is built for health and wellness professionals and business owners, because hopefully we can all reach out to one another, connect, and just build more collaborations, help expose everybody else. Mm-hmm. But in terms of some of the favorite things, maybe the top 3 things that you've either worked with so far since you've been in practice, or that you enjoy working with in terms of physical or emotional issues that people are suffering from?
Okay, I think the number one thing that I have seen just a lot of success with is working with patients in migraines. A huge part of what I do is diet, and I have found that I've just seen a lot of patients overcome migraines and not have to be on medications or decrease their medications and overall just have better life just with a diet alone. So that's number one for me.
See, and that's the thing that I didn't even know that you enjoyed working with, because I've got like 4 people I can send you that have migraines.
Yes, and acupuncture is also very great. I have taken an example as a patient of mine, came in first visit, chronic migraines, got a migraine during our intake. We paused the intake. I said, let's do some acupuncture, and put the needles in, and within 5 minutes the migraine was gone. And that was the first time that patient I think first time had acupuncture, but the first time that patient was able to get out of a migraine without taking anything.
Awesome.
And that was also very rewarding for me, because that's what I live for as a doctor and as a naturopath and acupuncturist, is results and seeing my patients expose themselves to new possibilities with their health. So yes, migraines is number one.
Number 2.
Number 2, myself have suffered from a lot of GI issues that got diagnosed while I was in naturopathic school, and I enjoy working a lot with people who come with IBS, IBD, or just these vague symptoms with their GI system that they're unable to pin down. Again, the number one thing I do for that is diet, and it's really effective alongside whatever that patient is needing to help them.
And guys, this is when she says diet, it's a much more extensive, in-depth assessment than just your traditional, I'm going to hop on the paleo diet or I'm going to hop on the Mediterranean diet. So it's something designed specifically for you.
Yes.
Third.
The third thing, I guess, would just be, I don't know. I treat so many things. So to point out a third one,
Or one you enjoy.
What? How about this one's very interesting? Just chronic pain or acute pain. And this is more from the acupuncture standpoint. Again, seeing that immediate relief. I've had patients come in here, with wrist pain, thumb pain, do an acupuncture session, and it's reduced significantly, if not gone. I've had patients come in here with back pain, and we've done acupuncture, and again, they've gotten that immediate result. Or there's, they have some neck stiffness, or they need cupping, or they need other, modalities to help their pain. So I like helping patients get out of their pain acutely, and then also helping change their pain, getting rid of it by using my natural therapies, herbal anti-inflammatories, nutrients that are high antioxidants, and maybe helping them change their lifestyle and their stress to help their pain. And I think those are probably my top ones. If I'm thinking on the spot, I know tonight I'm going to go home and lay in bed and go, that other condition, I like that one too. But as a naturopath, I'm able to treat pretty much anything. And as I mentioned before, I don't mind collaborating. I love to collaborate with medical doctors and really have a good healthcare team. Ultimately, with my patients, it's never my long-term goal to have them to need to be on anything long-term.
Right.
It's my goal to help build you up, help build up what's deficient, allow your body to make and maintain those levels, whether it's through diet and lifestyle, etc., and then send you on your way. I think the best thing I can do for my patient is to never need you to come back. And, it might mean 3 treatments, probably more than that, or it might be, a year or 2 of seeing me. But ultimately, my goal is to help empower my patients so that they can take control of their health and decide their own fate.
Awesome. So real quick as we end, I want everybody out there watching, you YouTubers, to make note of what she just said in terms of actually helping to progress your client or your patient so that you don't have to continue coming back. If you're going to some of these other professionals and they're telling you that they want to see you for 3 days or 4 days for the rest of your life, there's something going on, because they should be helping you so that either you can help yourself, right, which is what I do. I like to teach people how they can better take care of themselves, or what you're doing with the professional is working in conjunction with what you should be doing on your own or your homework, and that you can come back less and less, or maybe you do a follow-up every couple weeks or every couple months, but you don't have to be consistent. That's the same thing with what I do too, so I preach that all the time. Real quick, website up and running?
It's placeresnaturopathic.com.
Okay, placeresnaturopathic.com. We're going to put that up there as well for the link.
Stay tuned, because I'm launching a new program soon that I think current patients as well as prospective patients might really enjoy, and I'm really excited to get that going.
So we'll have you check out the website. The link will be up.
Up or down?
It'll be up probably above our heads on the video. Do you want to throw your email out there or no? They can find it on your website.
If you want to contact the clinic, which is Placeres Naturopathic and Acupuncture, it's info@placeresnaturopathic.com.
Awesome. Okay. So, thank you, Amanda.
Thank you.
For being featured on Own Your Shit. Coming upcoming episodes. It's late night. I'm chewing my tongue all day.
It's like 6 o'clock.
It's late here. Upcoming episodes, we're going to have... who are we going to have? We're going to have a lot of different people. So I'm not going to tell you. I want you to stay tuned to check out.
Because he doesn't know.
It's because I don't know yet. But I want you to check it out. All right, guys. Thanks for watching. I'll see you in the next episode of Own Your Shit.